Question 1. What is the first action a nurse should take when a patient's condition deteriorates suddenly? A. Administer prescribed medications immediately. B. Assess vital signs and physical condition. C. Call for assistance from the healthcare provider. D. Notify the patient's family. Answer. B. Assess vital signs and physical condition. Rationale. The nurse should first assess the patient's vital signs and physical condition to identify the immediate cause of the deterioration. While notifying family and calling for assistance are important, assessment must always come first to guide the next steps. Question 2. Which of the following actions best demonstrates a nurse's use of clinical judgment in managing a patient with an acute myocardial infarction, MI? A. Administer oxygen and monitor the patient's blood pressure. B. Start a heparin drip and prepare for a coronary angiogram. C. Perform a focused cardiac assessment and consult the healthcare provider. D. Notify the family while preparing for discharge. Answer. C. Perform a focused cardiac assessment and consult the healthcare provider. Rationale. Clinical judgment in managing an MI involves immediate assessment and consultation with the healthcare provider to determine the next steps, such as further testing or interventions. Administering medications or notifying family is premature without proper assessment and guidance. Question 3. How should a nurse prioritize care for a group of patients in a busy emergency room? A. Focus on the patient with the most stable condition. B. Prioritize the most complex and medically unstable patients. C. Address the patient's immediate concerns, regardless of severity. D. Provide care in order of arrival time. Answer. B. Prioritize the most complex and medically unstable patients. Rationale. In an emergency room, the most medically unstable patients with life-threatening conditions should be prioritized, following the triage system. Stable patients and those with less urgent needs should be cared for later. Question 4. When educating a patient about post-operative care, how can the nurse best ensure the patient comprehends and retains the information? A. Speak slowly and clearly while providing written instructions. B. Use medical terminology to explain the procedure in detail. C. Assume the patient understands and provide only a brief overview. D. Provide information only once and expect the patient to recall it. Answer. A. Speak slowly and clearly while providing written instructions. Rationale. Effective patient education requires clear communication and written instructions to ensure understanding and retention, especially after surgery. Using medical jargon or providing information just once can lead to confusion and poor compliance. Question 5. In which of the following situations would it be most appropriate for the nurse to consider ethical dilemmas in their clinical decision-making? A. A patient refuses a life-saving blood transfusion for religious reasons. B. A patient requests a different healthcare provider. C. A patient demands a higher dose of pain medication. D. A nurse disagrees with the physician's treatment plan. Answer. A. A patient refuses a life-saving blood transfusion for religious reasons. Rationale. Ethical dilemmas arise when patient autonomy conflicts with medical recommendations. A patient refusing life-saving treatment based on their religious beliefs is a critical ethical issue, requiring careful consideration of the patient's rights and well-being. Question 6. When performing an assessment on a patient who has a history of substance abuse, what is the most important consideration for the nurse? A. Focus solely on the patient's physical symptoms. B. Document any signs of intoxication or withdrawal. C. Encourage the patient to acknowledge their substance use. D. Withhold judgment and maintain a non-judgmental approach. Answer. D. Withhold judgment and maintain a non-judgmental approach. Rationale. The nurse must maintain a non-judgmental approach to foster trust and encourage honest communication. Documenting signs of intoxication and withdrawal is important, but judgment or forcing the patient to acknowledge substance use can damage the therapeutic relationship. Question 7. A nurse is preparing to administer a medication that the patient has previously experienced an allergic reaction to. What should the nurse do next? A. Administer the medication, but monitor for side effects. B. Inform the physician and request an alternative medication. C. Proceed with administering the medication to avoid delays. D. Withhold the medication and document the refusal. Answer. B. Inform the physician and request an alternative medication. Rationale. If a patient has a known allergy to a medication, the nurse must inform the physician and request an alternative medication. Administering a known allergen can cause severe harm, and withholding without informing the healthcare team is not an appropriate response. Question 8. What action should a nurse take if a patient who is not mentally competent demands to leave the hospital against medical advice? A. Notify the patient's family immediately. B. Respect the patient's decision and assist in leaving. C. Inform the healthcare provider, document the situation, and assess the patient's decision-making capacity. D. Wait for the patient to calm down and reattempt the conversation later. Answer. C. Inform the healthcare provider, document the situation, and assess the patient's decision-making capacity. Rationale. The nurse should assess the patient's decision-making capacity, document the situation, and notify the healthcare provider to ensure the patient is not making an uninformed or unsafe decision. This helps protect both the patient and the healthcare team legally. Question 9. In an advanced clinical decision-making scenario, what is the nurse's primary responsibility when a patient exhibits signs of sepsis? A. Administer broad-spectrum antibiotics without waiting for the culture results. B. Assess the patient's vitals and initiate rapid sepsis protocol. C. Provide fluid resuscitation and wait for further lab results. D. Consult the family for decisions about the patient's care. Answer. B. Assess the patient's vitals and initiate rapid sepsis protocol. Rationale. The nurse must first assess vital signs and initiate the sepsis protocol, which may include antibiotics, fluids, and monitoring. Administering antibiotics without full assessment may be premature. Consulting the family should be secondary to immediate intervention. Question 10. How can a nurse best evaluate the effectiveness of a patient's care plan in achieving desired outcomes? A. Review the patient's medical history and lab results. B. Ask the patient if they feel better since starting the treatment. C. Observe the patient's physical and emotional response to the treatment plan. D. Rely on the healthcare provider's assessment of the patient's progress. Answer. C. Observe the patient's physical and emotional response to the treatment plan. Rationale. The nurse should evaluate care by directly observing the patient's physical and emotional responses, as this gives insight into the treatment's effectiveness. The patient's subjective opinion is important, but objective observations are the best indicators. Question 11. What is the most important consideration when administering pain medication to a patient with chronic pain? A. Focus on the patient's reported pain level and administer the prescribed dose. B. Monitor the patient for side effects and adverse reactions after administration. C. Administer the medication only if the patient requests it. D. Encourage the patient to reduce their medication use to avoid dependence. Answer. B. Monitor the patient for side effects and adverse reactions after administration. Rationale. It is crucial to monitor for adverse reactions and side effects after administering pain medications, especially in chronic pain patients who may be on long-term therapy. Focusing solely on pain levels or medication reduction can be insufficient. Question 12. How should a nurse manage a situation where a patient's treatment plan is not achieving the expected outcomes? A. Adjust the treatment plan independently based on personal experience. B. Review the treatment plan, collaborate with the healthcare team, and reassess the patient's condition. C. Discontinue the treatment immediately and wait for further orders. D. Document the situation and continue with the same plan without changes. Answer. B. Review the treatment plan, collaborate with the healthcare team, and reassess the patient's condition. Rationale. If the treatment plan is ineffective, the nurse should review and reassess the plan in collaboration with the healthcare team to make necessary adjustments. Independent changes or inaction can delay proper care. Question 13. What is the most critical factor when caring for a patient in the ICU with multiple organ failure? A. Focusing on pain management and sedation. B. Prioritizing airway management and respiratory support. C. Monitoring vital signs and lab results frequently. D. Educating the family about the prognosis and care plan. Answer. B. Prioritizing airway management and respiratory support. Rationale. In cases of multiple organ failure, airway management and respiratory support are critical to sustaining life. Monitoring vital signs is important, but securing the patient's airway is the highest priority. Question 14. When a patient's family requests to be present during a procedure, what should the nurse do? A. Allow the family to be present without consulting the healthcare provider. B. Assess the patient's wishes, discuss with the healthcare provider, and make an informed decision. C. Refuse the family's request to maintain a sterile environment. D. Inform the family they cannot be present under any circumstances. Answer. B. Assess the patient's wishes, discuss with the healthcare provider, and make an informed decision. Rationale. The nurse should assess the patient's wishes, discuss the matter with the healthcare provider, and then decide whether the family can be present. Patient safety and comfort must be prioritized. Question 15. What is the best approach when faced with a difficult ethical decision involving a patient's autonomy and beneficence? A. Always prioritize patient autonomy, regardless of medical recommendations. B. Consult with the healthcare team and involve ethics committees if necessary. C. Decide based solely on the nurse's personal ethical beliefs. D. Prioritize beneficence and disregard the patient's wishes. Answer. B. Consult with the healthcare team and involve ethics committees if necessary. Rationale. When there is a conflict between autonomy and beneficence, consulting the healthcare team and potentially involving ethics committees ensures that decisions are made ethically and collaboratively, respecting both the patient's rights and medical expertise. Question 16. How can a nurse best assess the effectiveness of a patient's discharge plan? A. Monitor the patient's progress in follow-up appointments. B. Rely on the patient's verbal acknowledgement of understanding. C. Document the patient's discharge and assume compliance. D. Provide written instructions only and assume understanding. Answer. A. Monitor the patient's progress in follow-up appointments. Rationale. The nurse should assess the effectiveness of the discharge plan by monitoring the patient's progress and outcomes in follow-up appointments. Verbal acknowledgement or documentation alone does not guarantee understanding or success. Question 17. What is the most important factor when caring for a patient with a mental health disorder in an acute crisis? A. Focusing on providing medication immediately. B. Ensuring patient safety and establishing rapport. C. Providing family counseling and emotional support. D. Assuring the patient's physical comfort and rest. Answer. B. Ensuring patient safety and establishing rapport. Rationale. The first priority in an acute mental health crisis is ensuring the safety of the patient and establishing trust. Medication and comfort follow once the immediate psychological safety is addressed. Question 18. What action should a nurse take if a patient develops signs of a potential allergic reaction to a medication? A. Discontinue the medication and contact the healthcare provider immediately. B. Administer antihistamines and continue the medication. C. Document the reaction and continue the medication as prescribed. D. Withhold the next dose and wait for the symptoms to resolve. Answer: A. Discontinue the medication and contact the healthcare provider immediately. Rationale: if an allergic reaction occurs, the nurse must immediately stop the medication and contact the healthcare provider for further action. Continuing the medication or waiting for the symptoms to resolve can cause severe harm. Question 19. How can a nurse best handle a situation where a patient's family requests that no information be shared with the patient about their terminal condition? A. Respect the family's wishes and avoid informing the patient. B. Provide all information to the patient, disregarding family requests. C. Involve the healthcare provider and discuss the patient's rights and autonomy. D. Document the family's request and avoid further discussion with the patient. Answer: C. Involve the healthcare provider and discuss the patient's rights and autonomy. Rationale: the nurse must respect the patient's autonomy and right to information. Involving the healthcare provider ensures that the decision aligns with ethical standards and patient rights. Question 20. What should the nurse prioritize when caring for a patient experiencing acute respiratory distress syndrome, ARDS? A. Ensuring the patient is comfortable and pain-free. B. Providing oxygen therapy and monitoring respiratory status. C. Administering pain medication to reduce discomfort. D. Encouraging the patient to rest and avoid unnecessary movement. Answer: B. Providing oxygen therapy and monitoring respiratory status. Rationale: in ARDS, the priority is ensuring proper oxygenation and managing the patient's respiratory status to prevent further complications. Comfort and rest follow after addressing the immediate threat to breathing. Question 21. A nurse is caring for a patient with acute respiratory distress syndrome, ARDS. The patient has a PaO2/VO2 ratio of 130 and is on mechanical ventilation. What is the most appropriate action? A. Increase the tidal volume to improve oxygenation. B. Initiate high-frequency oscillatory ventilation. C. Apply positive end expiratory pressure, PEEP, to improve oxygenation. D. Administer a sedative to reduce anxiety and improve ventilation. Answer: C. Apply positive end expiratory pressure, PEEP, to improve oxygenation. Rationale: PEEP helps improve oxygenation by preventing alveolar collapse and enhancing gas exchange. Increasing tidal volume could worsen ventilation, and sedation does not directly improve oxygenation in ARDS. Question 22. A patient on a ventilator has developed ventilator-associated pneumonia, VAP. The nurse should prioritize which of the following actions? A. Increase the ventilator settings to improve oxygenation. B. Administer prescribed antibiotics and perform suctioning. C. Perform a chest X-ray immediately to assess the extent of the infection. D. Decrease the sedation to encourage the patient to cough up secretions. Answer: B. Administer prescribed antibiotics and perform suctioning. Rationale: early antibiotic administration and suctioning to clear the airway are critical in managing VAP. Changing ventilator settings or decreasing sedation can be done, but is secondary to immediate infection control. Question 23. A patient with sepsis is receiving fluid resuscitation. The nurse observes a decrease in blood pressure despite administering 2 liters of crystalloid fluids. What is the next best action? A. Administer vasopressors to support blood pressure. B. Continue fluid resuscitation with another 2 liters of fluid. C. Initiate corticosteroid therapy to support blood pressure. D. Switch to colloid fluids for better volume expansion. Answer: A. Administer vasopressors to support blood pressure. Rationale: in sepsis, if fluid resuscitation fails to raise blood pressure, vasopressors like norepinephrine are required to maintain perfusion. Increasing fluids further could lead to complications, and corticosteroids are generally reserved for refractory cases. Question 24. When caring for a patient receiving chemotherapy, the nurse notes that the patient's absolute neutrophil count, ANC, is 500 per cubic millimeter. What is the most appropriate action? A. Administer growth factor therapy to increase neutrophil production. B. Restrict all visitors to minimize infection risk. C. Start a broad-spectrum antibiotic to preemptively treat infection. D. Continue with chemotherapy and monitor the ANC closely. Answer. B. Restrict all visitors to minimize infection risk. Rationale. A low ANC increases the risk of infection, so restricting visitors and implementing infection control precautions is critical. Antibiotics are not administered preemptively unless an infection is suspected. Question 25. A nurse is caring for a postoperative patient with a nasogastric NG tube. The patient is experiencing nausea and vomiting. What is the priority action? A. Flush the NG tube with saline to clear any blockages. B. Monitor the patient's vital signs and respiratory status. C. Reposition the patient and attempt to aspirate the NG tube. D. Administer antiemetic medication as prescribed. Answer. B. Monitor the patient's vital signs and respiratory status. Rationale. The priority is to ensure the patient's airway is not compromised and that they are not at risk of aspiration. Administering antiemetics or repositioning the patient can help, but are secondary to monitoring. Question 26. A nurse is caring for a patient who has been diagnosed with a serious chronic condition. The patient expresses feelings of anger and disbelief. What is the best response by the nurse? A. Minimize the patient's concerns by focusing on the positive aspects of their diagnosis. B. Reassure the patient that everything will be fine. C. Acknowledge the patient's feelings and provide a listening ear. D. Suggest that the patient seek therapy to help cope with the news. Answer. C. Acknowledge the patient's feelings and provide a listening ear. Rationale. Acknowledging the patient's emotions and providing emotional support helps build trust and ensures the patient feels heard. Reassurance and therapy suggestions can follow once the patient's feelings are addressed. Question 27. A nurse is caring for a postoperative patient with a nasogastric NG tube. The patient develops abdominal distension and discomfort. What is the first action the nurse should take? A. Irrigate the NG tube with saline to relieve the distension. B. Assess the NG tube for proper placement and patency. C. Administer a prescribed laxative to relieve the discomfort. D. Notify the healthcare provider and wait for further instructions. Answer. B. Assess the NG tube for proper placement and patency. Rationale. Assessing the placement and patency of the NG tube is essential to rule out tube obstruction or displacement. Irrigation, medication administration, and notifying the provider are secondary interventions. Question 28. A nurse is caring for a patient with sepsis and hypotension despite receiving adequate fluid resuscitation. What is the first priority intervention? A. Administer norepinephrine to support blood pressure. B. Administer a second round of fluid resuscitation. C. Monitor the patient's oxygen saturation and respiratory status. D. Start broad-spectrum antibiotics immediately. Answer. A. Administer norepinephrine to support blood pressure. Rationale. In patients with sepsis and hypotension, vasopressors like norepinephrine are the first-line treatment to support perfusion. Fluid resuscitation and antibiotics are important, but are secondary to restoring blood pressure. Question 29. A nurse is caring for a patient who is receiving high-dose corticosteroid therapy for an autoimmune disease. What is the nurse's priority assessment? A. Assess the patient's blood glucose level regularly. B. Assess for signs of infection, such as fever or wound drainage. C. Monitor the patient's blood pressure for signs of hypertension. D. Encourage the patient to exercise to prevent muscle weakness. Answer: B. Assess for signs of infection, such as fever or wound drainage. Rationale: corticosteroids suppress the immune system, increasing the risk of infection. Monitoring for signs of infection is the priority, followed by blood glucose, blood pressure, and exercise as secondary concerns. Question 30. A nurse is caring for a patient with a head injury who has been prescribed an opioid analgesic for pain. The patient's respiratory rate decreases, and the nurse notes shallow breathing. What is the most appropriate action? A. Administer a naloxone Narcan. Reversal dose immediately. B. Reduce the opioid dose and monitor the patient's condition. C. Administer oxygen and encourage the patient to take deep breaths. D. Notify the healthcare provider and await further orders. Answer: A. Administer a naloxone Narcan. Reversal dose immediately. Rationale: opioid-induced respiratory depression is life-threatening, requiring immediate administration of naloxone. Oxygen and monitoring are necessary, but not sufficient without reversal of the opioid effects. Question 31. A nurse is caring for a patient who has just undergone a kidney transplant. The patient shows signs of acute rejection. What is the priority intervention? A. Increase the dose of immunosuppressive medications. B. Administer corticosteroids as prescribed. C. Monitor renal function and document the findings. D. Notify the healthcare provider and prepare for further diagnostics. Answer: D. Notify the healthcare provider and prepare for further diagnostics. Rationale: acute rejection requires immediate attention and further diagnostic tests to assess the extent. Increasing immunosuppressive medications or administering corticosteroids can be done, but must be directed by the healthcare provider. Question 32. A patient in a long-term care facility is becoming increasingly agitated and confused. The patient has a history of dementia. What is the nurse's first action? A. Administer a sedative to calm the patient. B. Assess for potential medical causes of the change in behavior. C. Offer reassurance and attempt to redirect the patient's attention. D. Notify the healthcare provider of the change in behavior. Answer: B. Assess for potential medical causes of the change in behavior. Rationale: agitation and confusion in a dementia patient could be caused by an underlying medical issue, such as infection or electrolyte imbalance. Assessment should be the first priority before offering sedation or notifying the provider. Question 33. A patient presents with a suspected pulmonary embolism, PE. The nurse is preparing for a CT scan to confirm the diagnosis. What is the most important action the nurse should take while waiting for the test results? A. Administer anticoagulant therapy as prescribed. B. Ensure the patient is positioned upright for optimal breathing. C. Monitor the patient's oxygen saturation and respiratory status. D. Prepare the patient for a thoracotomy if the PE is confirmed. Answer: C. Monitor the patient's oxygen saturation and respiratory status. Rationale: monitoring oxygenation and respiratory status is critical while awaiting confirmation of PE, as it may worsen rapidly. Anticoagulation therapy may be initiated but requires a healthcare provider's order. Question 34. A patient with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy. The nurse notes that the patient is becoming increasingly confused and lethargic. What is the priority action? A. Increase the oxygen flow rate to improve oxygenation. B. Assess the patient's blood gas levels and oxygen saturation. C. Administer a bronchodilator to improve airway patency. D. Notify the healthcare provider immediately. Answer: B. Assess the patient's blood gas levels and oxygen saturation. Rationale: the patient's confusion and lethargy could indicate worsening respiratory function or CO2 retention, requiring immediate blood gas analysis and monitoring. Increasing oxygen flow in COPD patients must be done cautiously to avoid respiratory depression. Question 35. A nurse is caring for a patient who has a history of heart failure and is receiving a diuretic. The patient presents with dizziness and hypotension. What should the nurse do first? A. Administer the prescribed diuretic as scheduled. B. Decrease the diuretic dosage and monitor the patient's blood pressure. C. Elevate the patient's legs and increase fluid intake. D. Notify the healthcare provider and prepare for a blood transfusion. Answer. C. Elevate the patient's legs and increase fluid intake. Rationale. In this scenario, the patient may be experiencing hypotension due to fluid depletion. Elevating the legs helps promote venous return, and increasing fluid intake helps restore circulatory volume before notifying the provider. Question 36. A nurse is caring for a postoperative patient who has been diagnosed with deep vein thrombosis, DVT. The patient is on anticoagulant therapy. The nurse should monitor for which of the following complications? A. Pulmonary embolism. B. Renal failure. C. Hyperkalemia. D. Sepsis. Answer. A. Pulmonary embolism. Rationale. Pulmonary embolism is the most serious complication of DVT, as a clot may dislodge and travel to the lungs. Monitoring for signs of PE, such as shortness of breath and chest pain, is a priority. Question 37. A patient is recovering from an ischemic stroke and is being started on aspirin therapy. What is the nurse's priority assessment before starting the medication? A. Assess the patient's renal function. B. Assess for any signs of gastrointestinal bleeding. C. Monitor the patient's heart rate and rhythm. D. Check the patient's blood glucose level. Answer. B. Assess for any signs of gastrointestinal bleeding. Rationale. Aspirin can increase the risk of gastrointestinal bleeding, especially in stroke patients. The nurse should assess for any signs of bleeding before administration. Question 38. A nurse is caring for a patient with an indwelling urinary catheter who develops signs of infection. What is the priority intervention? A. Increase fluid intake to flush out the infection. B. Remove the catheter and send it for culture. C. Administer antibiotics as prescribed. D. Notify the healthcare provider immediately. Answer. B. Remove the catheter and send it for culture. Rationale. If a catheter-associated infection is suspected, removing the catheter promptly is critical to prevent further infection. Sending it for culture helps identify the causative organism. Question 39. A patient with chronic kidney disease is undergoing hemodialysis. The nurse observes that the patient's blood pressure is significantly lower than before. What is the first action the nurse should take? A. Administer a bolus of normal saline to increase blood volume. B. Contact the healthcare provider to adjust the dialysis prescription. C. Document the finding and continue to monitor the patient. D. Increase the flow rate of dialysis to improve fluid removal. Answer. A. Administer a bolus of normal saline to increase blood volume. Rationale. Hypotension following dialysis is often due to volume depletion. Administering a saline bolus helps restore intravascular volume. Adjusting the dialysis prescription or increasing flow rate may be necessary later, but are secondary to immediate intervention. Question 40. A nurse is caring for a patient with a history of ischemic stroke who is receiving warfarin therapy. What is the priority intervention? A. Monitor the patient's INR levels to ensure therapeutic range. B. Assess for signs of hypovolemia and dehydration. C. Administer vitamin K if the patient shows signs of bleeding. D. Reduce the warfarin dosage to prevent bleeding complications. Answer. A. Monitor the patient's INR levels to ensure therapeutic range. Rationale. Monitoring the International Normalized Ratio, INR, is critical to ensure that the patient is within the therapeutic range for anticoagulation, preventing both bleeding and clotting complications. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.